Okay, diabetes is a lifestyle disorder. That means you have to manage the lifestyle. So if you control lifestyle, you may not become a diabetic. And if you are pre-diabetic, you may not become a diabetic. And if you are diabetic, your diabetes is beautifully managed and it may regress over a period of time. And all that is done by lifestyle changes. I am Dr. Seema Kale, Senior Physician Consultant at Delhi, India. So today I am going to walk you through what are the 5 most important pillars of lifestyle changes in diabetes management. The first most important pillar is stay active. So you have to stay active. What do I mean by that? That means you, for every small thing, you yourself get up and walk. Okay. You don't ask others to do the work for you. So this is in general being active. Second is follow the FAR rule. FAR, FAR rule. F is for flexibility, A is for aerobic exercise, and R is for resistance training. So flexibility, you have to do some bending exercises, some abs exercises. And I tell you, the best flexibility in the body comes from yogic exercises. That is our ancient yoga. This gives you the best flexibility. And then when it comes to aerobic exercise, the WHO recommends 150 minutes of brisk walk, at least, in a week. So that will amount to like 30 minutes brisk walking 5 days in a week. So that much walking should be done. Now, the most important part of the exercise is resistance training. Resistance training is so important and we tend to forget it because how you can do resistance training? Again, I think the yoga is the best because yoga uses your body as a weight and resistance to do the exercise against it. Like you're doing Surya Namaskar, you are doing, that plank thing. So they are all using your own body. If you don't have anything, you can use water bottles to do your arm exercises. You can use TheraBand or you can purchase weights from the market. So little bit of resistance training, 5 to 10 minutes should be done at least 3 times in a week. Resistance training and protein supplementation. These two are hand and glove phenomena, and they both go long way to reduce or prevent sarcopenia in diabetic patients. Sarcopenia is a muscle loss. And mind you, with aging in our diet, many things, the requirement for many nutrients come down. But protein is one thing where the requirement goes up. So we have to increase our protein requirement in the diet. So the third pillar is diet. And when you increase protein requirement in the diet, along with some resistance training, your muscle strength and muscle mass is maintained. And that is very important to reduce the progress of aging. Very, very important. And that will also actually take care of the diabetes control because insulin resistance is reduced. So a good quality protein is mandatory and the requirement is more than 1 gram per kg of the body weight in as you grow old. Other than that, reduce carbohydrate in the diet. And whenever you are taking carbohydrate, take healthy carbohydrate, which is actually carbohydrate with fibers, such as fruits, vegetables, salads, and whole grain cereals, oats, dalia, etc. These are the healthy carbohydrates. What about fats? Fats should be eaten, especially because they give you essential oils, essential fatty acids, and PUFA and MUFA. They are important for our muscle and liver functioning and growth of the joints. But you should not have trans fatty acids. That means fried stuff should not be taken. You should not refry the oil. Or any good vegetable oil can be taken. Olive oil is good. Canola oil is good. Even a little amount of ghee is not bad, but you should avoid cheese. So that comes to the diet part of it. So third pillar was have a healthy and happy diet, right? So our fourth pillar is with the exercise and the diet that you are doing, you are going to reduce weight. So the fourth pillar is reduce weight. And if you are overweight, but if you are underweight, You should try to gain a weight a little bit by doing resistance training, by increasing the muscle mass and increasing your protein intake again in the diet. So when you reduce like 5 to 10% of the body weight, it will go a long way in preventing the diabetes complications. So this was the fourth pillar. Now I come to the fifth pillar. A fifth pillar is they again the most important pillar. All the five pillars are important, but I think fifth pillar, especially in these times, is very important. And what is that? De-stress yourself. So reduce the stress. My dear friends, stress is a phenomena which we actually generate ourselves. So it's like if you want to reduce your stress in life, you should learn to reduce. Just like you learn everything in life, you have to learn to reduce stress. You have to learn to be happy. And that's very easy actually, but it's a task that you have to take in with yourself, because to be sad all the time is very, very easy. It's the easiest thing in the world. But you must reduce stress. You must take things or whatever you are working happily and enjoy the process of living and doing day-to-day tasks. And that is how your stress will go down. And when you are taking care of all these five pillars, I'm very sure that you will not become a diabetic, in fact. And if you are diabetic, whatever treatment you may take, lifestyle management is the core therapy, and you must manage your lifestyle. And Jai Hind.